Welcome to another episode of our expert interview series where we interview experts in the field about various topics. Today we'll be talking about Alzheimer's and the brain, and the expert that we have here today with us is Courtney. Before we start, I will hand it over to her to introduce herself.
Hi everyone, I am Courtney and I'm so excited to be here today on this expert video series. A little bit about me, I'm a fifth year PhD student at the University of Kentucky in the Sanders Brown Center on Aging in the US. And my research is looking at Alzheimer's disease and how certain genetic risk factors implicate or specifically impact the brain. And for my project, I'm using both human autopsy tissue and animal models to really start diving into these questions and learning what's going on in the brain.
Amazing. Thank you so much for introducing yourself. I'm going to get right into the questions. So the first question we have for you is, can you explain the difference between Alzheimer's and dementia?
Yes. So these two terms they're often used interchangeably, and they are related, but they're not the same. So we typically call dementia the umbrella term. So it's going to be the blanket term describing types of dementia. For example, Alzheimer's disease is a type of dementia. So Alzheimer's disease is going to fit underneath that umbrella, and that falls along with other types of dementia, such as frontotemporal dementia, vascular dementia, and there's a whole host of others that would fit under that umbrella. And these types are more based on what's going on in the brain, and that's what's going to be classifying the specific type, and the overarching idea of dementia is more of the overarching symptom.
Thanks for clarifying that. I think a lot of people can get confused at differentiating Alzheimer's and dementia, so thank you for that. And then leading into the next question, what are the warning signs of Alzheimer's?
Yes. So this is one that I actually give a talk on. It's called the 10 Warning Signs of Alzheimer's Disease. And one disclaimer that I do like to give at the start of that presentation is that if you hear of certain symptoms for Alzheimer's disease, I'm going to give you a list. Not every patient is going to have every symptom, and people are going to have them at different times to different extremes. So there are differences between normal aging and these warning signs, but no two patients are going to be the same. So like I said, there are 10 warning signs. I'll go through them quickly. So there's memory loss that's going to disrupt daily life, challenges in planning and problem solving, difficulty completing familiar tasks. So if you've typically been making a recipe your whole life and all of a sudden are struggling with that, that could be one of those. Confusion with time or place, trouble understanding visual images, new problems with words or speaking, misplacing things and losing the ability to trace your steps. Like if you leave your keys in the fridge, and if I were to see my keys in the fridge, I'd be like, oh yeah, I went straight to the fridge. But somebody with dementia might not be able to trace their steps and think, oh, why are my keys in the fridge? Some other ones are going to be decreased or poor judgment. So they might just go buy a boat for no reason. Withdrawal from work or social activities, and changes in mood or personality. And so these are just 10 of the warning signs. There are others. And again, not everybody has to have all of these. But if you start noticing any of these symptoms in yourself or a loved one, be sure to talk with your doctor, because the early diagnosis is incredibly important for clinical trials and therapies. Like you need to have that early diagnosis to really be able to be put in any of those categories.
Awesome. Thanks so much for going over that. Yeah, that's a lot of symptoms to go through, I guess. I think people sometimes think they need to have all the symptoms, but I like that you clarified, you can have one symptom and then another symptom can also come along later. So the next question I have is, why does Alzheimer's affect memory and what actually happens in the brain?
Yes, so this is really getting into where my expertise lies. So Alzheimer's disease specifically targets these cells in your brain called nerve cells or neurons. And these are really important in sending signals throughout your brain. And these cells are going to help form memories, thoughts, and feelings. And Alzheimer's disease specifically is going to be targeting and leading to the death of these cells. So if you have these cells that are helping you form memories, if they start dying in your brain because of the pathology, you're going to have problems with memory. So that's one reason. And then also the area of the brain specifically that Alzheimer's disease really, really impacts is called the hippocampus. And this is often called the memory center of the brain. So it's going to be, if you were to look directly into your head, it's going to be right behind your ears. and a little bit in. And it's this hippocampus. It kind of looks like a seahorse. And it's the memory center of your brain. So if Alzheimer's disease is specifically targeting those nerve cells in that region, that's going to be leading to even more problems. And so that's once your hippocampus is starting to have problems, it's when a lot of the symptoms start occurring.
That's really interesting. We love to hear the different kind of side of it, the science side as well.
Yeah.
And now I'm just going to throw it over to Svetlana because she has some questions for you as well.
Perfect. And thank you so much, Courtney, so far. I'm just going to continue here with the fourth question, which is, what are the early stages of Alzheimer's and what does that actually look like in the brain? So what happens in the brain as Alzheimer's progresses into its later stages?
Yeah, so early stages of Alzheimer's disease, like when you start seeing it clinically, you've actually already typically gone through about 10 years of having pathology in your brain. So Alzheimer's disease is already occurring in your brain about a decade before any symptoms start to occur. And so when the point that you've reached symptoms, your memory center has started being affected and more problems have started in your brain. So that's why we always say an early diagnosis is really important, because you have those 10 years where we can't pick it up. And so before the brain even gets symptoms, you start forming these amyloid beta plaques. And these typically start in the cortex region of your brain, so the bigger part, and they kind of move down and back in your brain. And these plaques are kind of what I describe as cotton balls in your brain. They're just like sticky little plaques that just block signals being sent through your brain and really start wreaking havoc on your brain. But those can start at that 10-year before symptoms start occurring. So you're going to get the plaques, and then later you start developing these tau tangles. And these tau tangles are going to form inside of those nerve cells. And the way I typically describe this is like the walls of the nerve cells start to just fold in on themselves. And so that's when you're going to get these tau tangles. And if you have problems in the neurons, that's going to lead to the neurons not firing properly, not sending those signals that you need to make the memories and the thoughts and everything. And that leads to the cells dying as well. So both of those start occurring. So we have plaques for a while, and then the tangles pick up. And so you're going to have both of them in your brain, leading to all of the clinical symptoms and more problems in your brain in Alzheimer's disease.
Perfect. Thanks for your explanation. Like Tana said, it's so nice to hear the science side of it. So thank you for explaining that. And then moving right along. So what causes amyloid plaque buildup in the brain? And are there ways to prevent this that could potentially prevent Alzheimer's disease?
So this question we don't really know the answer to. It's actually one of those like black boxes. Everybody has their own opinion as to how the amyloid beta gets built up in the brain. But we know amyloid beta it's made as a much longer protein called the amyloid precursor protein. And then it gets cut through a whole host of processes. But if it gets cut in the wrong place, it's going to make a stickier protein. And that amyloid beta that forms those cotton balls is kind of sticky. So we're just going to get these sticky proteins in the brain, and that's going to lead to a spiral of your whole brain kind of responding to this amyloid beta being present. What actually leads to the full pathology level is not fully known. It's still up for debate. Most people think the amyloid beta starts misfolding. It starts being cut improperly, misfolding, and then you spiral. But there's plenty of other theories as to why this could be the case. There's ones that are looking at, do viruses lead to this? There's a whole viral hypothesis. There's an inflammation hypothesis, since head injury is a risk factor. So if you hit your head, that leads to inflammation. Could that lead to downstream Alzheimer's disease pathology in the long term? So there's a lot of different theories out there, but we still don't exactly know the whole thing that's happening.
Definitely. And that's why we need amazing researchers like you. So thank you so much for clearing that up. And then my last question is, what are your thoughts on the new Alzheimer's drug, Adducom? So we understand it has been a little bit controversial due to the cost, the side effects, and the potential need for further studies to be conducted. So just wanted to get your opinion on that.
Yeah, so this new drug is definitely a definitely controversial. So I do want to start off by saying that anything that I do say here is just my opinions. It's not based on my center or any group that I work with. But basically what this drug does is it's targeting that amyloid beta that I've mentioned, the sticky protein. It's targeting that in the brain. And the idea is that if we can get it low enough, early enough, we might be able to delay that spiral that leads to all of the other problems. And while I really do hope that this drug actually works like it says it should work, I still think that more studies are definitely needed to be able to say definitively, does it actually do what they're saying it does? And the FDA did, when they requested this, they did request that the drug continue to be put in more trials. But while those are still being done, a doctor, if they're comfortable, can start giving it to patients now. So that is one thing going on. So I know that doctors here at my university have started talking with patients about that. So that is a little bit on where it's at. The side effects are definitely one thing that I agree are probably one of the harder parts of this medication, mainly because the way that it's been marketed is not like they don't really talk about they don't really address the side effects in the medication paperwork. I don't really know how to describe that, but basically a lot of studies have shown that if you remove amyloid beta from the brain, that can lead to brain bleeds, and those need to be monitored. We need to take images of people's brains to really get an idea of what's going on so we can prevent, if a brain bleed does occur, we can just stop the medication and try and prevent them in the long term. And I know doctors are going to be monitoring that, but it's not in the paperwork that says that needs to be done with each patient. And the patients in these trials were like the top of the top patients that were not going to really have those problems. So more studies are definitely needed. And I think just monitoring the patients is going to be the hardest part for doctors. And going back with your question about the controversy with the cost, I agree, it is absurd. There's no reason for it to be as high as it is. Drugs are expensive to make, so that's fair, and it is a harder drug to administer, but not to the extent that it's like $56,000 a year, which is insane. And that's just going to further any health disparities that we already see in dementia and really any disease. And so I just don't think that that's a good place. So I know a lot of groups have really been pushing to get that price down. But overall, this drug, it's exciting and it gives patients and caregivers a lot of hope, that's for sure. And honestly, really pushing the field forward. But I think we really need to understand how it works a little bit more before we fully are like, yes, let's do this thing. But again, that is just my opinions on that. There are plenty of them online.
Yeah, definitely. Thank you. It's a really interesting topic now in this field, right? So thank you so much for discussing about it. So those are all of the questions that we have time for today. Thank you so much, Courtney, for this great interview and all of your expertise and knowledge that you've shared with us today. And then before we end up the episode, is there anything else that you would like to add in or anything that you want to say to the viewers to conclude?
No, I just want to say thank you for having me today. And if any of your viewers have any questions or want to follow up, they can reach out to me on Instagram. I'm the social neuroscientist, and you're more than welcome to send me any questions that you have.
Okay, perfect. And that will be linked below. And thanks for tuning in to today's expert interview episode. And please stay tuned for the next one.